What's the best blood pressure for older adults? Know the real truth. If you're over the age of 70 and your doctor has recently celebrated bringing your blood pressure down to what they consider ideal, like 120 over 80, it's crucial for you to pay close attention to this information. A significant study published in the esteemed Journal of the American Medical Association followed over 15,000 seniors for a period of 5 years. What the researchers discovered actually goes against much of what we've been taught about target blood pressure numbers for older individuals. The study found that seniors who maintained what's often referred to as perfect blood pressure actually had a 28% higher risk of experiencing severe falls. What's even more concerning is that their mortality rates, meaning their risk of death, were found to be worse compared to those who had slightly higher blood pressure readings. In the coming minutes, I'm going to explain the specific blood pressure range that has been linked to the longest lifespans in older adults, why the standard blood pressure target might actually pose a danger after the age of 75, and a simple, actionable test you can perform in your own home tonight that could potentially prevent a devastating fall. I am Dr. from Michael Kent, and the insights I'm about to share have the genuine potential to save your life or the life of someone you care about. Before we dive deeper, please take a moment to leave a comment below with just your age. No other details are needed, just your age. I'm very interested to see who is watching this, as the information I'm about to present applies differently depending on whether you are 65, 75, or 85 years old. And if you've ever experienced feelings of dizziness when you stand up from a chair or when getting out of bed, please add the word dizzy to your comment. This is incredibly important information for me to see, and you'll understand why in about 3 minutes from now. Let's consider what's happening in doctors' offices across the country on a daily basis. Imagine a 78-year-old individual visits their doctor for a routine checkup. Their blood pressure is measured at 145 over 86. The doctor consults the standard medical guidelines on their computer screen, notes the target of less than 130 for the systolic number, and without hesitation reaches for their prescription pad. A medication is prescribed and then often another is added. Over the next 6 months, the patient's blood pressure impressively drops to 124 over 78. The doctor is satisfied, and the patient receives a commendation on their medical chart, signaling a successful outcome to everyone involved. However, this scenario highlights a critical gap, what the standard guidelines often fail to account for. Consider that same 78-year-old individual who now needs to get up to use the restroom during the night. They stand up and their blood pressure plummets from 124 over 78 down to a dangerously low 88 over 56 within mere seconds. Their brain isn't receiving adequate blood flow. The room begins to spin. They try to steady themselves by reaching for the wall but miss. In an instant, the conversation shifts from blood pressure numbers to the grim reality of a fractured hip, followed by emergency surgery, a lengthy 3-week rehabilitation period, and a cascade of complications that too frequently result in a loss of independence or even worse outcomes. The groundbreaking research that was published just a few months ago in JAMA Internal Medicine truly deserved to be front-page news everywhere. Yet, the reality is that most doctors haven't yet seen it, and the vast majority of patients certainly haven't heard about it. This significant disconnect between what the latest scientific research reveals and the practices implemented in everyday medical care is unfortunately costing lives. Here's a piece of information that might sound quite surprising, and I urge you to stay with me as we explore this, because this is where a fundamental shift in understanding occurs. For many decades, the prevailing medical advice has been straightforward. A lower blood pressure generally equates to better health outcomes, and for middle-aged adults, individuals in their 40s and 50s, this advice holds largely true. Effectively managing blood pressure during midlife is instrumental in preventing serious conditions like heart attacks, strokes, and kidney disease later in life. The evidence supporting this is exceptionally strong and well established. However, something fundamentally changes once individuals reach the age of 75. Emerging research indicates that seniors who maintain a systolic blood pressure between a 130 and a 145 actually tend to live longer than those whose blood pressure is below 120. These individuals also experience fewer falls, fewer fractures, fewer hospitalizations, and often demonstrate better cognitive function. Conversely, the group that achieved that supposedly ideal reading of 120/80 experienced higher rates of dizziness, syncope, which is the medical term for fainting, acute kidney injury, and, regrettably, higher mortality rates. Now, if you're someone who values understanding the why behind medical recommendations rather than simply being told what to do, then what I'm about to explain will provide you with an entirely new perspective on managing blood pressure as you get older. Your cardiovascular system at 75 years old is not merely an older version of your cardiovascular system at 45. It is fundamentally different in ways that significantly alter the meaning of blood pressure readings for your health. Let me break down 3 critical changes that occur with aging and why these changes necessitate different blood pressure targets. Firstly, there's arterial stiffness. As we age, our arteries gradually lose their elasticity, becoming less flexible. Think of the difference between a brand new garden hose and one that has been exposed to the elements for 2 decades. The older hose is stiffer and less pliable. Your arteries undergo a similar process, known as arteriosclerosis. When your heart pumps blood into these stiffer arteries, they are less able to expand and absorb the surge of pressure that occurs with each heartbeat, unlike the way young, flexible arteries can. Consequently, a slightly higher baseline blood pressure is required to ensure that sufficient blood flow reaches vital organs like your brain and kidneys, especially when you are standing upright, as blood must work against gravity. Secondly, the function of your baroreceptors declines. Baroreceptors are incredibly sensitive, tiny sensors located within your blood vessels. Their primary role is to detect changes in blood pressure and instantly signal your brain to make necessary adjustments. In younger individuals, when they stand up, their baroreceptors detect the immediate drop in pressure within milliseconds and trigger rapid compensatory responses. Your heart rate increases, your blood vessels constrict, and your blood pressure stabilizes. However, these crucial baroreceptors become less responsive with age, meaning they react more slowly. If your resting blood pressure is already on the lower side and your baroreceptors are sluggish in their response, you're much more likely to experience that dangerous drop in blood pressure when you stand up, a condition known as orthostatic hypotension. Thirdly, medication metabolism changes. As we age, our kidneys and liver become less efficient at clearing medications from our system. A dose of blood pressure medication that is perfectly appropriate and safe for a middle-aged person can actually be excessive for an older adult. The medication can remain in your system for a longer duration, exerting stronger effects and potentially driving your blood pressure too low. Now, let me provide you with the specific findings from this very recent research, because the details are incredibly important. The study published in JAMA Internal Medicine involved the analysis of data from 15,342 adults who were over the age of 75, and they were followed for an average of 5 years. It's important to note that these were not a select group of exceptionally healthy seniors. Rather, they represented real-world older adults, including individuals who had conditions such as diabetes, a history of strokes, heart disease, and varying degrees of frailty. The researchers meticulously tracked the average blood pressure of these participants and then monitored their health outcomes over the 5-year period. They categorized the participants into different groups based on their systolic blood pressure readings. One group maintained a pressure below 120, another group was between 120 and 130, a third group was between 130 and 140, a fourth between 140 and 150, and the final group had pressures above 150. Here's what they discovered. The group that experienced the lowest mortality rate had a systolic blood pressure between a 130 and 140. This is not a pressure below 120, nor is it that textbook perfect number, but rather a moderate range. Individuals with blood pressure below 120 were found to have a 28% increased risk of serious falls that required hospitalization. They also experienced higher rates of acute kidney injury, indicating that their kidneys were not functioning optimally with such low blood pressure. Furthermore, their overall mortality rate was a significant 14% higher compared to those in the 130 to 140 range. As one might expect, the group with blood pressure above 150 also faced increased risks, including higher rates of stroke and cardiovascular events. However, the truly surprising finding was that very low blood pressure proved to be just as dangerous as very high blood pressure. The optimal range, the sweet spot associated with the longest survival and the best quality of life, was actually higher than what conventional medical guidelines typically recommend. Picture this scenario. You are 76 years old and you visit your doctor for a routine checkup. Your blood pressure is measured at 142/84. Your doctor expresses concern, consults the guidelines, and advises, we need to bring this down to at least 130 and ideally closer to 120. You are then prescribed a medication. 2 months later, your blood pressure has successfully lowered to 128/78. Your doctor is pleased and suggests adding a second medication to achieve an even lower reading. Another 2 months pass, and your blood pressure is now 122/76, seemingly perfect. Initially, you feel fine. However, you gradually begin to notice subtle changes. When you stand up from your chair to answer the phone, you feel a brief moment of lightheadedness. When you rise from the dinner table, there's a fleeting instant where the room appears to tilt. You mention these sensations to your doctor, who attributes them to the natural aging process, suggesting your blood vessels are adjusting more slowly and advising you to stand up gradually. But what's actually happening is that your blood pressure, which appears excellent when you're sitting still in the doctor's office, is dropping dramatically when you transition from sitting at 122/76 to standing, possibly down to around 95/60. Your brain is consequently experiencing repeated episodes of insufficient blood flow. You are at a significantly increased risk for a fall, yet this risk isn't being identified because your sitting blood pressure readings look textbook perfect. This type of scenario unfolds thousands of times every single day across the country, and it is entirely preventable if we understand that blood pressure targets need to be individualized based on age and an individual's functional status, rather than being applied universally. What I find truly astonishing is that there is a simple test, which takes only about 3 minutes to complete, that can identify whether your current blood pressure medications are putting you at risk for falls. This test is called an orthostatic vital sign measurement, and regrettably, most doctors are not performing it routinely. Let me guide you on how to perform this test in your own home tonight, because this information has the potential to be life-saving. You will need a home blood pressure monitor, which are readily available at most pharmacies for around $30. Here's the protocol. First, lie down flat on your bed or a comfortable couch for 5 minutes to simply relax. After 5 minutes, measure your blood pressure while still, in the lying down position. Record both numbers, the systolic and diastolic readings. Next, stand up and immediately measure your blood pressure again while standing. Do not wait. Check it right away. Record these standing blood pressure numbers. Finally, compare the two sets of readings. If your systolic blood pressure has dropped by more than 20 points, or if your diastolic blood pressure has dropped by more than 10 points, you have orthostatic hypotension. This is a significant warning sign. It indicates that your blood pressure medications might be too potent for you, or that your target blood pressure goal may be too low for your body's natural physiology. Even if your blood pressure appears perfect when you are sitting or lying down according to traditional standards, if it drops this significantly upon standing, you are at an elevated risk for falls. To illustrate with a concrete example, imagine your lying blood pressure is 125/78. These numbers look great on paper. However, when you stand up, it drops to 98/64. That's a 27-point drop in your systolic pressure, which is concerning and potentially dangerous. Your brain is not receiving adequate blood flow when you are upright, which is the position you are in for most of your waking hours. You might feel perfectly fine while lying down or sitting, but when you are vertical, your body is functioning on insufficient pressure. This is precisely the test that your doctor should be performing at every visit if you are over 70 and taking blood pressure medications. If they are not doing so, you can easily perform it yourself and bring the results to your next appointment. So, what should your blood pressure actually be? I will provide you with the ranges that current research suggests are associated with the best health outcomes for different age groups. However, it is absolutely crucial to understand that these are guidelines, not rigid rules. Your individual target blood pressure should always be determined in careful consultation with your doctor, taking into account your entire medical history and overall health profile. For adults aged 65 to 74 who are generally in good health and maintain an active lifestyle with no major underlying medical conditions, research indicates that a systolic blood pressure range of 130 to 140 is considered reasonable. This range offers protection for your cardiovascular system while ensuring adequate blood flow to your organs. For adults aged 75 to 84 who are relatively healthy, the evidence supports a systolic blood pressure range of 135 to 145. You'll notice this is a slightly higher range than for the younger group. This adjustment accounts for the increased arterial stiffness and the slower responses of the baroreceptors that are characteristic of aging. For individuals over the age of 85, or for those who are considered frail regardless of their age, a systolic blood pressure range of 140 to 150 may be the most appropriate. At this stage of life, prioritizing the prevention of falls and maintaining a good quality of life often takes precedence over aggressively lowering blood pressure. Now, let's address the diastolic number, that bottom figure. For older adults, diastolic blood pressure should generally be maintained above 65, with an ideal range typically falling between 70 and 85. Very low diastolic pressure can compromise blood flow to the heart muscle during its relaxation phase and can lead to various problems. If your diastolic pressure consistently drops below 60, this is something that warrants a discussion with your doctor, even if your systolic numbers appear to be within an acceptable range. Consider the case of a 73-year-old individual who has type 2 diabetes and a history of one heart attack 5 years ago. Their blood pressure reading is 148/86. Should they be aiming for a target of 120/80? Most likely no. Should they aim for 150/90? Again, probably not. For someone in this specific situation, research suggests that a target systolic blood pressure around 130 to 135 might be optimal. This level is low enough to provide the necessary cardiovascular protection given their diabetes and heart history, but not so low that it poses a risk of orthostatic hypotension and falls. The absolute key is that any adjustment in blood pressure targets should be reached gradually, with meticulous monitoring for any potential side effects each time a medication is adjusted. Orthostatic blood pressure should always be checked, and any symptoms, like dizziness, fatigue, or foggy thinking, need to be carefully assessed. These symptoms can be indicators that the blood pressure is being lowered too much, even if the numbers on paper appear satisfactory. And here's a critical point that most people are not aware of. Blood pressure naturally fluctuates throughout the day. A single reading of 148/86 does not mean your pressure is consistently that high. It might be 132/78 in the morning and then rise to 145/84 in the evening. What truly matters is the average pressure over an extended period. This is precisely why home blood pressure monitoring is so incredibly valuable. It provides a far more accurate representation of your true average blood pressure than infrequent readings taken at the doctor's office. You might be wondering why, if this research exists and is so significant, your doctor hasn't brought it up. Why aren't the blood pressure guidelines for seniors more differentiated? The answer is complex, but it largely comes down to the slow pace at which medical practices evolve and the process by which guidelines are established. Most blood pressure guidelines are derived from large-scale clinical trials that have been conducted over many years. The landmark trials that established 120/80 as the ideal target were primarily conducted on middle-aged adults. When those results became available, the guidelines were then broadly applied to all age groups. The assumption was made that what is beneficial for a 50-year-old must also be beneficial for an 80-year-old. However, over the past decade, researchers have begun to focus specifically on older populations, and they are discovering that a one-size-fits-all approach is simply not effective. The challenge is that it takes years for new research to be integrated into clinical guidelines, and even longer for those updated guidelines to influence actual clinical practice. Many doctors continue to adhere to guidelines that were published 5 or even 10 years ago. They may not have encountered the recent research suggesting that a moderate elevation in blood pressure can actually be safer for very elderly individuals. There is also a significant psychological factor at play. For decades, physicians have been consistently taught that lowering blood pressure saves lives. This message has been deeply ingrained. It's incredibly challenging to shift from that ingrained mindset to a more nuanced approach that acknowledges that sometimes a moderate elevation in blood pressure is acceptable and, in some instances, even preferable. This requires doctors to critically evaluate each individual patient, rather than applying a universal target. In our current healthcare system, where doctors often have very limited time, typically around 15 minutes per patient, adopting this individualized approach becomes exceptionally difficult. Let me illustrate how vastly different two individuals of the exact same age can be. Both are 81 years old, but their health circumstances could not be more distinct. The first individual is living independently, generally doing well, but managing several chronic conditions, including mild heart failure, stage 3 chronic kidney disease, and osteoarthritis. Their blood pressure is recorded as 158/88. The doctor's inclination is to initiate aggressive treatment to lower it below 130. The second individual, also 81, is in excellent health, remains active, plays golf twice a week, and has no significant medical problems. Their blood pressure is also measured at 158/88. The same number, the same age, yet entirely different risk profiles. For the first individual, who has multiple existing health issues, initiating multiple blood pressure medications carries significant potential risks. These medications could lead to an excessive drop in blood pressure, particularly when standing. They could exacerbate existing kidney problems and potentially cause dizziness and an increased risk of falls, which, in combination with osteoarthritis, could have catastrophic consequences. A more sensible approach in this case might involve focusing on lifestyle modifications first. Then, if medications are deemed necessary, a low dose of a single medication could be used, with very careful monitoring, accepting a target of perhaps 140 to 145 systolic, rather than aggressively pursuing a lower goal. For the second individual, the healthy 81-year-old, a blood pressure of 158/88 might warrant treatment. However, again, not aggressive treatment. Lifestyle changes might effectively lower it to 145/84, which, for a healthy individual of that age, could be perfectly acceptable without the need for any medications at all. The same blood pressure numbers, two different people, and two entirely different treatment approaches. This is what is meant by treating the patient, not just the number. Let me now provide you with specific, concrete action steps that you can implement starting tonight. First, if you are over 70 years old and are currently taking blood pressure medications, please purchase a home blood pressure monitor if you don't already own one. Measure your blood pressure at the same time each day for a period of 2 weeks, both in the morning and in the evening. Keep a written log of these readings. This will provide you with an accurate average and help you identify any patterns. Second, perform the orthostatic blood pressure test that I described earlier. Lie down for 5 minutes, measure your blood pressure, then stand up and measure it immediately again. If you observe a drop of more than 20 points in your systolic pressure or more than 10 points in your diastolic pressure, record this information to discuss with your doctor. Third, honestly assess your symptoms. Are you experiencing dizziness when you stand up? Do you suffer from unexplained fatigue or difficulty concentrating? These symptoms could be indicators that your blood pressure is too low, even if your readings appear fine. Fourth, schedule an appointment with your doctor specifically for the purpose of discussing your blood pressure targets. Do not simply accept a generic statement that you need to achieve a blood pressure of 120/80. Ask your doctor what target blood pressure is appropriate given your specific age, any other existing medical conditions you have, and your overall functional status. Bring your home blood pressure log with you. If you found a significant drop during your orthostatic measurements, bring those results as well. Engage in an informed conversation with your doctor. Fifth, if you are experiencing any side effects from your blood pressure medications, please voice them. Do not endure discomfort in silence. Many individuals assume that feeling dizzy or fatigued while on medication is simply something they must accept as a part of aging. However, it's often possible to adjust medication dosages, switch to different medications, or modify blood pressure targets to significantly improve your quality of life while still ensuring adequate cardiovascular protection. Here's what you now understand that a significant portion of the population, including many healthcare providers, do not fully grasp. Blood pressure targets should not be uniform for everyone. A 45-year-old and an 85-year-old should not be held to the exact same standard. For older adults, particularly those over 75, a systolic blood pressure in the range of 130 to 145 is associated with the longest lifespans and the best quality of life. Readings below 120 increase the risk of falls, orthostatic hypotension, kidney injury, and potentially even cognitive decline. Blood pressure readings above 150, on the other hand, increase the risk of cardiovascular events. The optimal range, the sweet spot, lies in the middle. You have learned that orthostatic hypotension, that drop in blood pressure that occurs when you stand up, is often more dangerous than having a moderately elevated blood pressure when sitting. You have also learned how to test for this condition in your own home. Furthermore, you have gained an understanding of the physiological reasons why older adults require different blood pressure targets, including arterial stiffness, slower baroreceptor responses, and altered medication metabolism. Most importantly, you now possess the knowledge and the vocabulary to have a truly informed discussion with your doctor. You are no longer a passive recipient of medical advice. You are an active and informed participant in your own healthcare journey, and that is incredibly empowering. You are now more knowledgeable about blood pressure management in older adults than perhaps 90% of people your age. You understand the nuances, and you recognize that a universal approach is not always the best approach. If the information provided in this video has brought you clarity, if it has answered questions you've been pondering, and if it has given you the confidence to advocate for yourself, then I have achieved my goal. Please leave a comment below right now saying "informed" if you feel better equipped to discuss this topic with your doctor. If you believe this information could benefit others, please share this video with your friends or family members who are over 65. Subscribe to this channel because my mission is to provide you with research-based health information that is accessible, practical, and has the potential to be life-changing. In my upcoming video, I will be discussing 3 supplements that research has shown can genuinely support healthy blood pressure naturally, along with 2 popular supplements that are, unfortunately, a complete waste of money. You will definitely want to watch that one, as the supplement industry is rife with misleading claims, and I will be presenting you with exactly what the scientific evidence says. I look forward to seeing you there. This video is intended for educational and informational purposes only and should not be considered medical advice. Blood pressure management should always be individualized, taking into account your complete medical history, current health status, and other relevant factors. Never adjust or discontinue your medications without first consulting with your healthcare provider. The information presented is based on current research, but should not be a substitute for professional medical care. Always seek the advice of a qualified healthcare provider before making any changes to your treatment plan.